The other thing then that I want to know is, the general thing, do they get hay fever, allergy or asthma? Because they can tie in with airway and breathing problems. I also want to know about whether they've got, problems with their hearing, because around about 20-ish% of children will have a buildup of fluid behind their eardrums when they've got upper airway obstruction, but not necessarily be having ear infections. So they can be walking around partly deaf because their head's basically underwater, which of course can affect learning, concentration, behaviour. So it can have a dual effect. They can be tired and deaf, which is an absolute disaster for education outcomes. And then building on that, you want to know about the infective bit, you want to know about the tonsillitis, you want to know about the ear infections. But by about that stage, at least when it comes to tonsillitis, I'm pretty disinterested, quite frankly, as to whether that's part of the story or not, because if they've got airway obstruction and I'm having a look inside and seeing massive tonsils, I don't care about tonsillitis. It's a completely irrelevant part of the conversation. But of course, we ask about it because it's part of just formulating the clinical case. So that's your history bit. And then I jump over to the examination, and my job's pretty easy. I look inside the ears, nose and throat. I don't, sometimes it really is simple. People can overthink these things sometimes, and I can give you the overthought, story as well. But basically, I look inside the ears. What I'm looking for is any fluid behind the eardrum. Easy.